Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
I am pleased to welcome back Dr. William Seeds, a leading authority in orthopedic surgery and sports medicine with over 22 years experience. Dr. Seeds, if you'll please tell us a little bit about your practice.
Well, as you said, I'm an orthopedic surgeon. I specialized in total joints and sports medicine. And I run a sports joint type of practice in northern Ohio. I work out of the Spire Institute, and it is more focused on high-end Olympic and pro athletes, and I've just been fortunate enough to be in a place that I get to do some really cool things in helping people get through injuries and repair and get them back to function, and that's part of my practice. That's my orthopedic practice, and then I have a functional medicine practice that's a little unique in its integrative, focused on what I've been working on with the International Peptide Society and building a real focus on peptide type of therapeutics and therapies.
So you've built an incredible career in the field of sports medicine, working as a medical director of orthopedic rehab and sports medicine at a USA Olympic training site, and as a consultant for the highly acclaimed TV show Dancing with the Stars. Where did your interest in this industry first begin, and how has it developed since?
You know, you do some good things, you help some people, and word gets around and they come to you. I've been lucky to give good outcomes to people seeking, having serious injuries and problems where they need to get back to their pro career or their profession or their sport. And that's kind of how, it's just, you know, like you said, I've been around for 22 years. It doesn't happen overnight, and it's just a build of really patient advocates for yourself that kind of push that word out in that type of environment. So I've just been very, very lucky.
Through your own extensive clinical expertise, as well as the chairman for International Peptide Society, you've grown a wealth of knowledge regarding the most effective applications for peptide therapies. Can you briefly explain how peptide therapy operates? What are some common misconceptions regarding peptide therapies that you'd like to dispel?
Those are really good questions that I think we really are focused in. You know, I think peptides are really just cell signaling agents that are naturally occurring in the body. We have over 7,000 of them and more. And we're familiar with these peptides, we're familiar with the signaling agents that we have and what they do, and we're in a time where we can actually recreate and synthesize these peptides that our body makes to restore function, to help repair, to do the things the body knows how to do. So we have this incredible opportunity to start working with something of the most intelligent design, your body, that knows how to do things in repair, restoration. You know, we work with the body in signaling the body and the cells of what they want to do to get back to a state of what we call homeostasis. And peptides are basically just amino acids that are sequenced with peptide bonds, and they can be 3 amino acid chains, they can be up to 25. And they're basically just around for 10, 15, 20 minutes in the blood system to kind of start that cascade of signaling agents of what we want to do to pinpoint or, so to speak, surgically execute precision mechanistic changes of a cell. Because we can do that now. So we can, instead of treating a disease, we can actually go after the beginning, the precursor of why it may have started, and that's profound if you think about it. If you think about where this has gone and what we can do, I mean, that's the way it should be. It turns it around. It gives us the chance to be, as an orthopedist, I repair things, I fix things. As a functional medicine physician, I feel like I'm a healer now. I feel like I make real, not that I'm not in orthopedics, but I really impact some lives because I can preempt disease. I feel like we're in a great state where we actually can slow aging, and we can theoretically, if we've been on target with this, we can prevent autoimmune disease, we can prevent cardiac disease, we can prevent neurodegenerative disease, we can prevent osteoporosis, we can prevent type 2 diabetes. That's a profound statement. But I would argue I can sit and I could convince you through the pathways of the cell and what we know with certain peptides, we can turn that around. And we're doing it. And the most incredible thing right now that's happening, and I'm just so humbled by this society we've created where we've got doctors from everywhere sharing their stories and how we're treating disease. That's a powerful, powerful place when you get a lot of healthcare providers together discussing cases from all over the world. That's pretty powerful. I'm learning. I'm learning from people that have learned from me. How awesome is that, right? They make me think. They make me look at something differently. And I'm like, this is crazy. This is why we all went into medicine. We went into medicine because we were excited about taking care of people. We were excited because we want to be healers. Holy smokes, that's what's happening.
So how did you discover peptide therapies? How did you come to find this revolutionary,
That's a long story. It starts, and I'm good at this now because I've been emotional about it in the past. It actually started a long time ago when I was 16, 17, and I had an episode of where I was very close to my father. We were running. He died from jogging, and I couldn't save him. And it was traumatic for me. I was an athlete. I was the guy who could take care of everything. I couldn't save my father. And that was really tough for me. But it gave me this drive of, and focus of, I got to figure some things out because nobody's giving me answers. It did make sense because my dad was healthy. My dad was a exercise enthusiast. He was my best friend. We read, we did things together. It was great. And it was just tough to see that happen. And I couldn't do anything, right? So I went to school and I ran into this book that was written by Dirk Pearson and Sandy Shaw called Life Extensions, Clinical Application. It was a book about 700 pages long. And I'm looking at this book and I'm like, that's for me. I need to look at that book. I bought it. It was the early 80s. And I'm a finance major in college. And I got this book and I read it. 700 pages. I read it in like 3 days. I knew nothing about that book when I got it done with it. I was like, oh my gosh, this is just full of chemistry, biochemistry, and molecular biology stuff. I had no idea. I understood absolutely nothing. I was committed because I had one of those things like I just have a drive to do things. I read that book over 33 times through college. I took every page. They taught you in the book how to research, which, it was an amazingly written book because it really taught me how to look into literature. I knew nothing, but I took the steps of researching because back then you had to go in the library. So here I am. I'm this finance accounting major, and I'm in these libraries searching out articles to help me learn what I'm reading, which I have no idea what I'm reading. But I'll tell you this, when I was done 3 years later, I knew that book. I basically memorized it, but I knew a lot more than I thought. And I was helping people do things. It was just interesting. And I just had this I all of a sudden had this paradigm change and like, what am I doing going into finance? I need to go into medicine. And that's kind of what happened. And so the peptides thing was an evolution from this book, because it's all about, you read something and it creates questions. And interestingly enough, I mean, insulin was one of the first peptides that was introduced here to the US. Most doctors don't know they use peptides, but they use insulin. Insulin was one of the most amazing peptides ever discovered. That was more the cell signaling, cell receptors, resistance of receptors. It was just fascinating, you know. And that's also the beauty of the cell. The cell covers all silos of medicine. So I wasn't just reading about insulin, I was reading about how its effect is affecting athletes, affecting cancer. I mean, I was looking at everything. And I think that just gave me a kind of a global view of a lot of things that I didn't know where I was building. And the peptide stuff just kept coming up. I mean, it was in everything. It was just fascinating. And I'm thinking, wow, there's more to this. There's more to this. And then you started seeing some studies coming out that were done. Actually, I started finding that these were being utilized around the world. And it just built. It built. And I've just been fortunate to be in some places where it really had some application with me early on because of orthopedics. And I wanted to work on me being able to get something that I could utilize that was safe, that was sterile, that was pure, and that was right, where I could really help some people with some injuries that in the past maybe I couldn't do much for. I could help them, but I couldn't get them back to maybe that state or better. But I knew how to do it. I absolutely knew how to do it. And then it happened, and I had some opportunities, and oh my gosh, I can remember all of it vividly, and again, humbling, you know, to change people's lives. So let me give you an example of two very special people, Max and Peter. They both were in positions of where their careers were pretty much finished. I took an opportunity to help them and get them back in repairing some injuries. But I want to tell you, the most amazing part of that journey with both of them, because they've been peptide adapters for 7-8 years. I mean, but what's amazing is when you change somebody's life and you repair something that everybody told them they couldn't do, they're done, and you not only repair that, but you turn their life around, but you make them feel better about themselves, you change a lot of things in their body. What happens is they want to know more.
My name is Maksim. I'm a professional dancer. Dr. Seeds like to say that I'm also an athlete. I think so just by the fact that when we met, at the time that we met, I was going through a lot of aches and pains due to my career as a dancer. So that's how I knew that what we're doing is very athletic, because it all hurts. So at 32, around that time, I was already at the end of my professional dance career. In our profession, I lasted till 32, which was a great, achievement in itself. So I wasn't sad. I was just kind of like ready for that next stage in my life, and I was given an incredible opportunity to quite literally get reborn in what I do, and sort of get second lease on life, which came in the form of Dr. Seed. I don't think Doc even saw a dance step in his life until that moment. So he started to fix me up, and I noticed that it wasn't just about the dancing, really. He just kind of called it that's what we're going to try to accomplish, but it was just the entire sort of life reset, from nutrition to just overall activity to the resting to understanding why, and the benefit was that I spent almost a decade just getting better and feeling better with each new sort of like adjustment that I'm making with my life, and some of the products that Doc is introducing the world to, really. So I consider myself very lucky to be one of the first, patients to have started to be Doc's little experiment, and then here we are. And it worked, so great, good result.
Hi, I'm Peter Murgatroyd, and I am a professional dancer. I've been on Dancing with the Stars for probably 7 years now, and I met Dr. Seeds along the way through my husband, Max. I was going through a lot of pain, a lot of struggles through Dancing with the Stars and all the touring that I've been doing. And Max introduced us and told me about this doctor that can heal you. He's an amazing orthopedic surgeon. He's this, and this. And I was like, okay, gotta meet this guy. I'd previously had operations on my feet before, but nothing had really worked to the extent and gotten me back on my feet like Dr. Seeds did. And we started doing therapy. We started working from the inside out, meaning health. What are you putting in your body? What are the vitamins you're taking? All of these things really came together for me and ultimately made me a better dancer, made my body stronger, and made my career just longer. And we did an operation in 2015, and that was a whole ankle reconstruction. I think that's what he calls it. I had 3 ligaments that were torn. I had floating bone in there, and lots of scar tissue. And I was dancing on this for many hours a day. I was actually on tour with Dancing with the Stars, and I couldn't really get through the tour well. It was a struggle for me at that point, and I just said, I got to bite the bullet. I got to take a season off. I have to get this fixed. It had stemmed from many years of ballet. I'd been dancing since I was 4, so there was a lot of wear and tear down there. So we went in, we fixed the ankle, and through a lot of other therapy, vitamins, all sorts of different machines that he would put on me to make this just get better quicker. Along with the help of peptide optimization as well, which was just one of the best things that he did bring into my life. I got back on my feet. My ankle has never been better. It's stronger than before, even probably before I had my first surgery. It was like a brand new ankle. So right now, I guess I'm one of the oldest women on the troupe of Dancing with the Stars, and I'm competing against these 20, 21-year-olds that are coming up, and I feel great next to them. I feel like I have just the same amount of energy, if not more. I feel like all of these years, Dr. Seeds has been preparing my body for just ultimate takeover of just being the strongest, the baddest, the fittest, the healthiest dancer that I can possibly be. And that makes me happy. I want to be able to dance for many more years now. I'm 32. I'm definitely not done yet. And I want to be able to make him proud and continue on with my dance career for as long as I possibly can.
They've become physical zealots of everything we're here today about. That's incredible when you can have that kind of an influence, and those people are influencers. So again, humbling, because I know I'm helping more people. I mean, how does that happen? It's the greatest thing ever. So very fortunate to be able to help people like that are influencers and good people.
Dr. Seeds, earlier today, you led a presentation titled Mitochondrial Function and Anti-Aging, Senescent Cells, NAD+, Rapalogs, and Peptides. Can you provide us with a brief overview of this presentation? What led you to select this topic to share with attendees?
That is a great question, and I'm really passionate about this because I had 30 minutes to put together 30 years of knowledge. And I was up for the challenge because there's so many amazing things that have happened. And I said, okay, let me pick some things that people are familiar with that are that word is a buzzword kind of. I'm reading about it. How do they all come together with peptides? And that got me excited because I'm like, I know that. Well, let's put it together. Developmental biology and regenerative medicine are basically very similar. And there's a bridge there. And in that bridge are all of these things I brought together today to kind of tell a story. If you take complicated things and you tell a story, people can walk away with a real understanding. Let's look at aging, let's look at disease, let's look at, can we really control aging? And we can't stop aging, but we can sure control it, right? We can sure control it. We can slow it down. So that was my job today, was to put this picture together so people could understand that what if we could change the way a cell handles stress, handles viruses, bacteria, stress, cold. What if we could help that cell handle the stress? Like it knows how to, but loses some of that as it ages, right? What if we can make that cell a little, give it those factors back signaling to handle that stress? What are we doing? Well, we're stopping that cell from becoming a bad senescent cell, and we're giving them an opportunity for that cell to be in a normal state, and hence you're slowing down processes and you're keeping these people away from all these other things that happen when you build up these bad cells. Cardiac disease, osteoporosis, cardiomyopathies, diabetes, cancer. Wow, right? So this really does set the stage for, guess what? Preventive medicine is everything. Preventive medicine is the future. And that is a primary job of mine and IPS and A4M. All of us are focused on changing the paradigm in this world of people understanding that, guys, let's get a little preemptive here because we can do it. So that was the story I tried to tell, to be compelling, but to have them walk away and go, hey, you know, that makes sense. And I kind of understand the biology and molecular pathways a little bit, and that wasn't so difficult.
Dr. Seeds, thank you so much for joining us today and for sharing your story, your vision for the future. It was very inspirational, so thank you.
Well, thank you, and I'm humbled to be here.